All right. Hey, everybody. Welcome back. I'm here today with Dr. Amanda Haynes, and she is one of our fellow Chiropractic Society Wisconsin docs. She's also an impact and influencer in the northwestern part of the state, which we're going to uncover here and unpackage for you today. But I wanted to have Dr. Amanda on. So, first of all, thanks for being here, Dr. Amanda. We're early in the morning getting started here, aren't we?
Yeah, absolutely. Thanks for having me. I'm excited.
So it's good to have you back. We talked in the past about some of the programs you're doing and the influence you've had in public schools with care, which is phenomenal to say the least. And that
Mhm.
has evolved into something larger as well, which you're going to share later. But let's come back, if we would, and set the stage as to why I wanted to have you as a guest again to basically unravel some of the things we talk about on a regular basis with kids and pediatric care. But
Mhm.
first of all, how did you get into this role, number one? And how long, how long have you been doing this and where where did this come from in terms of your practice approach?
Yeah, absolutely. So in about 2017, I came up to Wisconsin to shadow my business partner now and best friend, Dr. Lona Cook. And she has been an awesome leader in chiropractic. And I was like, okay, I want to take everything she's done and take it to Ohio, where I'm from, and open a practice. So I came up here to shadow her. And while we were here, she was like, hey, just come with me. We're going to go into the schools. I adjust the kids at school. And I was like, whoa, that's weird. Okay. I followed her into the schools, saw the program. And at that point, she was going into the schools for an hour every morning and then rushing back to practice in her brick and mortar and, serving her people in the practice. And anyways, long story short, I left Wisconsin and I sent her a text and said, I think I'm supposed to be there with you, like working on the school project. And she said, great, I'll see you when you graduate. So that was the kind of my interview. That was the start of how this all unraveled. And then I moved up to Wisconsin. And like I said, she only had an hour of time a day that she could devote to this project. And I came on full time of this is all I'm going to like think about, dream about, and put all my energy into it. And now we've exploded here in Northwestern Wisconsin. And we're truly meeting kids where they're at, getting them chiropractic care at school. And we're seeing great results. And we're ready to like really spread this throughout Wisconsin.
So let's clearly state how you guys are in the schools. So this is unheard of
Yeah.
that I've heard anywhere in the United States, right? I mean, you guys, Dr. Lona got into the school system. She was adjusting the kids on site, and
Mhm.
that expanded into now what exactly are you doing and where do you go every day?
Yeah, absolutely. So, you know, this is probably more foreign to chiropractors than it is to the public or to other professions. If you look inside the schools, there's dentistry, there's PT, there's OT, there's speech therapy, there's mental health services, and all of these services are coming into the school. So, how it originally started was a simple conversation of like, what else can we offer the staff? And how can we support our staff right now? And that happened in 2016, where they started the conversation. And then, as the staff started getting adjusted, more and more admin said, why don't you bring this on for the school or for the students? And it was really them asking us, like, can you do this? And now it has evolved into we are in three different school districts, nine schools within our school district now, where we see over 300 kids a week for weekly chiropractic care. And I think what's amazing about what we're doing is we're seeing a lot of kids that would not have access to chiropractic. A lot of the kids that we see have IEPs, which are individual lesson plans for themselves due to special needs or other circumstances. We see a lot of kids below poverty level that have, very difficult home life and social support. And at this point, how you enter even qualifying to get chiropractic is by a referral base of your teachers think there's maybe some extra support or some different steps that we should take. So we're serving kids that may not have access out of the four walls of school where they are. And we're taking it to them and they're getting consistent chiropractic care and the teachers are seeing results and the students are feeling better. It's just amazing to see.
So this is stating to me the obvious, obviously, clinically speaking, but there's many people that have questions about, as you know, the basic question is, why would my child even need chiropractic and who's thinking of this? Let's go back to the administrators and the staff you were taking care of and why they actually thought or postulated that their students might benefit from the care. Could you just start there?
Yeah. So one of the things we always talk about is the stress and the stress in the body. And our nervous system holds that stress. And what we don't realize is that, as adults, we might feel that stress come up as headaches or tension in our shoulders or things like that. In kiddos, they're not maybe complaining of headaches, but that tension is still in their spine and nervous system. So we've brought it to like a kid that can't sit still in school. Like his body is trying to tell us something. And instead of just dismissing it as another label or that, something's wrong with that child, we just gave them the idea of like, maybe that body, like that child, their body's trying to tell us something, and there's some extra energy in there, and we just need a place for it to go. And as you start to think about it as stress in the system and unwinding some of that stress, it's a no-brainer that all of us carry stress, no matter our age. And the benefits from unraveling that stress, we don't get to play God in the situation. We have no idea what's going to happen after an adjustment. However, we just know like as adults, when you get off the table, you're like, I feel so relaxed. I feel calm, a new person even. And the admin started to say like, okay, what if we did this for our children that are, bouncing off the walls or running out the building and tried to really give them a different tool besides medication.
So the brilliance in that, in what I'm hearing, and for those parents who don't know, who haven't thought of it, who question the fact that chiropractic might be safe and or effective for their child, the application in the mainstream model is that they have to hurt or have pain or have some form of dis-ease. Disease is actually how it's language there. And so they may wait that, I don't want to say this is trending because to say someone is behind the times that they don't get their child adjusted, there's the automatic fear factor in the medical modeling that says, hey, there's this classic old adage that we treat disease in the medical system and anything else there is questionable because they get the last word. My
Mhm.
point here is that as administrators and faculty, they obviously saw a problem. Their skill set with kids has been what, Dr. Amanda? Has it been more challenging over time? They feel like they're
Yeah, I
having a
think
hard time managing their classrooms and the behaviors of their kids.
Yeah, I think, the statistics don't lie. So if you really want to look at the statistics right now, it's like 1 out of every 4 kids has either asthma, allergies, ADHD, or autism. So
Four
right there,
A's.
the 4 A's, 1 out of every 4 kids has one of those. So as those numbers keep getting bigger and bigger, our autism diagnosis is out the roof right now. Our classrooms can't support that. These kids that might have functioned in a 1 to 20 ratio in a classroom now need to be in a 1 to 1 or a 1 to 2, as far as like teacher per student. That, gives problems with staffing, that gives problems with space. Like, where do we put these kids? And as the school district is really under a squeeze, especially post COVID, of like, how do we navigate this world that we're in? Like, there's definitely a time where it's like, okay, the system and the model that we're in is not working. And how do we introduce something new? And I think one of the things that has really stuck with me is thinking about how fast we are to medicate our kids. And we really have no idea what that's doing to their brain chemistry, to their development. And, if you tell a kid every single day that they have to take this pill in order to function, And you tell them that, and you tell them that, and you see it where, oh, he forgot his medication today and he's having a bad day. And you say it right in front of him. You just affirmed him that he needs a pill, something outside his body, in order to thrive. Then he goes through life. So that might be in second grade. And then he goes to middle school. And then it's another drug. And then it's high school. And then it's another drug. And then, we are in a pandemic of opioids right now and all of these other medications that what led the kid to believe that they needed that? Well, it could be as simple as in second grade, we told them they couldn't go to school without taking their medication. And I think if we can start to think about it like that, of like, you're right, we're programming our kids that they need a medication to survive, then yes, that could lead down the road to addiction of other kinds. So I think that's part of like where we're at, is like we have to start doing things differently, and really focusing on the kids, in my eyes, is the best place, because they're growing to be adults, right? And we're changing generations, hopefully, by starting young and working with the kiddos.
Yeah, very impactful. There's something else too that when you just mentioned that. So what I understand as well, recently it was published 33% of our kids, and that number is climbing fast. So in no time, we're at almost 50% with this. All right. So 33% of our kids are already diagnosed as diabetic. If they're
Yeah.
diabetic, they have a metabolic condition of inflammation. We
Mhm.
already know that affects that autonomic nervous system, and they are not functioning at their best. So in light of what chiropractic offers there as well, is the cascade of hormones that these little adolescents and growing bodies are going through, um, it can give them a chance to actually metabolize things more efficiently. Does it correct the problem when their food and their whole life is in disarray and they're constantly under stress? We don't know all those answers yet, but we do know that it has a negative impact on their growth, right? So
Absolutely.
so when you take the four A's, so allergies, asthma, autism, and
ADHD.
ADHD, okay, or ADD, same category, right? Um, there's some great stuff. Have you heard of Gabor Mate, by the way?
Yes.
Okay, so we're reading his book right now, my wife and I, and we've got a couple of them. But the point is, one is hold on to your kids, people, and the other um, has to do with ADHD and ADD as adults. And so, what's fascinating is this evolutionary piece, and why I'm mentioning that. To your point, Dr. Amanda, and I'd love for you to take this in that direction. Is so it's going to be an operative question. Is um, as he discovers, as adults, we all have ADD, and most of it is because none of us have ever escaped childhood. And so the role our parents played with their problem solving skills, and by the way, they did their best. There's no blame, shame here. It's we are a byproduct of their stress load as well, and the ability for them to process things. And so our interpretation of those adult mannerisms and or expressions, let's segue back into COVID and how that impacted our kids' developmental systems by masking and expression learning and all these things that they missed out on to interpret the world effectively. How
Mhm.
do you think that timing, maybe it's a loaded question, I'll try to narrow it down, the impact of that on what you're seeing, and then what you guys are doing to then help these kids not only bounce back better from that, but actually kind of reintegrate back into the system a little more effectively. So if you want me to reclarify, I can, but
Yeah.
I think
No,
you kind of
loaded
got my.
question for sure. It's interesting. I feel like, now we're like 2, 3, 4 post years of COVID, that you just keep seeing it's still showing up in different ways. Like right now, we have our kindergartners coming in, and their first few years of life, they had no exposure to other people, no socialization at all. So I think the speech, the development, the understanding of emotions, like we're really, really far behind. And then you meet your seniors in high school right now that were in middle school during this time. And it's like, that was like peak interaction of like, we should be playing with other kids. We should be, interacting with people our own age. And they didn't get that. And, it has trickled through every year where you're like, oh, these kids, like they're socially not here. And that probably is the biggest impact that I see, is like socially, but Socially leads to academically, it leads to physically, how they view their bodies, how they treat their bodies, all of these things. And I think what chiropractic is offering, you brought it up with hormones and metabolic conditions and things like that, is like chiropractic is quick. So these kids come in and they're not missing class for more than 5 minutes. They're laying down, but it's like a fresh set of hands, a fresh set of eyes that can view them as they're not broken and can see them for the light that they truly are. And even simple things like, hey, buddy, take a deep breath in. Like we might have been the only person that entire day that said, hey, why don't we breathe? The breath is so important. And, by the time we're adults, we're already done breathing. We stop breathing. We don't know how to breathe anymore. Where if we can start to teach our kids, like, hey, the breath is going to move the energy through your body, it's also going to fuel your body. Like, we got to give it energy, right? And just teaching them some of these skills that it takes 3 seconds to say, hey, take a deep breath. But it could change the trajectory of their day. And it could, just offer a different point of view for them and their system in that moment.
Well, it's brilliant. You're teaching them about a body process that's natural, right?
Hmm.
One of the things I ask is, are you breathing or is your body breathing you? What happens when you forget?
Yeah.
Right? So it's simple. The body is, but we get caught up in our environment. So these kids are under stress. The
Mhm.
doc, you gets to interpret where they're at. So let's clear up some really, really basic confusion with consumers and chiropractic and with the conditioning of disease orientation, mainstream medical model versus a holistic viewpoint of what the body can do. Does chiropractic cure these kids?
No.
Beautiful. So then, what is the benefit? And does chiropractic claim to cure these kids ever?
No, no. Chiropractic is a channel, it's a tool to open up their system to allow the energy to flow. Our body has an innate intelligence. Like you said, we don't have to tell our heart to beat or we don't have to breathe, like tell our body to breathe. It's going to naturally do that. However, if we can fix those channels, if we can open up that energy so that your system can work optimally, that's what chiropractic is doing. Your body is so intelligent. And I think we forget that. And that's like the most basic statement of like, two cells came together to form you. It's pretty miraculous. And if we can just give our bodies the light and love and attention it needs, it can thrive. So chiropractic is just one of those tools to help connect your system so that everything in your body can work the way it's designed to.
Beautiful. In with kids, that's a great answer, by the way. I love it. So I think it's so basic for people to realize where that lies. And then the reality is we're not trying to cure anything. We're literally giving the body you had described as opening it up. So opening these kids up to what is possible and the potential and what that nervous system does, which is fascinating. It'll segue into what you tend to see with these kids. So you gave us some indications of the current stressors they're under with diagnostic criteria in our society right now, where statistics don't lie. People do, but statistics don't. So when you see these kids, give us some feedback. Start with the administrators and the faculty and the teachers. What do they see in these kids since you've been adjusting them, and how'd you get to 300
Yeah.
and three school
So
districts?
I think it has really been an organic grassroots growth. And speaking to like what you were going off of earlier, is like, I never go in making any promises on or curing anything or, we are just here to simply help facilitate the day and hope that they have a better school day. And that's really how I've gone into each school of like, listen, I don't know, could this be a piece of the puzzle? Could this be something we could try? And at this point, they're willing to try. It's not going to hurt them. And there's no real reason not to try it. And I think the stories have spoke for themselves. And this is where like really, yes, we are doing research to really show what we're doing so that we can publish it. It can, have an academic standard, if you will. However, like the stories that you hear and the testimonials, that is what just keeps spreading into the other districts and spreading into the other schools. And I'll give you an example of there was this kid and it was Wednesday morning and he had spent 3 days, so Monday, Tuesday, Wednesday, outside in between the two glass doors going into the school building. and he was throwing things. He would just hang out there in the lobby because he couldn't be in his classroom. And when we walked through, I said, "Hi, he's one of my kiddos." And he was just like, "Mm." And I saw the principal shortly after that, and she said, "He's been there for 3 days. He won't come inside. He just throws things. He threw his tray against the wall yesterday." Um, and this was the path he was on. And she's like, "I don't know if he'll even come to you today." I'm like, "Okay." So we saw all the other kiddos. And then before I packed up, I was like, "All right, I'm just going to go see if he wants to come." And I went and asked him and I said, "Hey, do you want to come get adjusted?" And he said, "No." And I said, "Okay, we're going to leave then and we'll see you next week." Didn't force him to, just said, "Okay," and left the room. Because I think up until this point, it's been 3 days of people telling him, like, "You're bad, you're wrong, come here, you have to do this, you have to do that." So I just gave him the choice. "Do you want to get adjusted?" And he said no. So I go back, I'm starting to pack up my things, and all of a sudden my assistant goes, "Hey, Amanda." And he was standing in the doorway behind me. I was like, "Do you want to get adjusted?" And he starts grabbing my activator, which is the chiropractic adjusting tool, and just like throwing it around, clicking it. And I was like, "Hey, buddy, that's not for you to play with." So he puts it down, he lays down on the table, and he let me adjust him. Everyone got out of the room. It was just him and I in the room. He let me adjust him. He stood up, put on his shoes, and turned and went right and went back to his classroom. That was the first time in 3 days that he even stepped foot into his classroom. And I didn't tell him to. I just said, "Hey, buddy, we're done." And like, ended the adjustment. And he got up and walked and turned right and walked back into his classroom. And like, I can't make a story up like that, right? It's just like his system was so wound tight that he couldn't even verbalize what he needed. He couldn't regulate his emotions. Like it was like chaos inside his brain. And what did the adjustment do? It just calmed his system down and just allowed him to integrate and process what was happening in his world. Now, I would love to say like, "Oh, he spent the whole day in his classroom and then life was great." And no, that he struggles, but the adjustment definitely helps him to calm his system to step back into his classroom. And the principal noticed that. She saw what just happened, his teachers, they saw. And like, so that alone is what grassroots has opened this program to other administrators, other teachers, just saying like, "Wow, like, yeah, chiropractic is making a difference and it is changing the trajectory of their day, their school year, their life potentially." And just the fact that it's quick and, again, we're not making promises. We're just showing up and we're just saying, "Listen, we're going to adjust the body and let the body do what it needs to do." So that for us has been the biggest, like, heartwarming testimonial, like, things that really spread the project is just the good word of like what we're doing.
So what kind of opposition have you come against? Parents that may have a stigma and or are uneducated about what to expect. How do you both navigate that and what kind of issues have you had and is it that popular even or am I just making something up?
It's really not as popular as you think. I think more so the teachers and the school district is really where we spend most of our time educating on what we're doing and why. We don't have a lot of contact with the parents until the parents show interest or sign informed consent saying that they want their kid to receive care. So I don't talk to a lot of the parents that have rejections towards it because they just don't fill out the paperwork to say they want their kid to have chiropractic. So most of my time is spent educating the educators who are like the gateway to the kiddos. And in a lot of circumstances, they spend equally, if not just as much time as their parents. And they might be, in some situations, they know more about the child than their parents do. And really, if we can say, like, we are going to work on the stress in their system, and you probably see outbursts, like this potentially could help, have some outbursts or not have some outbursts and help their system to regulate. So the more education to the staff, and again, just those testimonials, they speak volume. I
With
believe the public is more ready than we are as chiropractors. So like we have this story that, oh, that's red tape, that's too hard, they don't know, and they're looking for solutions. They just don't know what it is.
Right. So why Dr. Lona? Why you? How'd that even start? Why did you guys get in?
Yeah. I mean, I think it's just having a bigger vision for chiropractic, for my life, for, it's not like we started and we made all this money and it was get rich fast. It was like we're in it for the heart and we are in it for the kids. And I think when you have a purpose outside of yourself, I think that's when things really come together. And, the right people have come in at the right time. Like I came to Lona when it was like Lona couldn't have grown it anymore because of time. Like she needed help, right? And now I'm grateful to say that we have three other chiropractors on our school-based chiropractic team that now are traveling to other schools and helping me facilitate care so that we can keep growing this thing bigger and bigger. So I think, it's not about us. It is fully about the project and the growth of it. And we had, so in chiropractic, there's a world-renowned researcher, Dr. Heidi Havoc, and she had caught wind of what we were doing in the schools. And she was like, I want to write and publish this. This is amazing. So again, the right people showing up at the right time, like we weren't asking. It wasn't even on our awareness that we needed research at that point, but she came in and said, "Hey, this needs published. We need to
Hmm.
like investigate this more." And I think that is a piece of the puzzle is like, yes, testimonials will get us so far. And then there's like the people that want to analyticals that want to see the data. And that's what we need to write up next. And so she is currently publishing two studies. One is a retrospective study of before we even met her, the care and what the kids and the results were prior to them meeting us. And then the second study is they actually came here from Australia and New Zealand, where we had Australia, New Zealand, and then Georgia Life University College. They were up here. And they did a feasibility study where they worked with our kiddos to like wear an EEG cap and like measure their brain and heart connection. And they did a bunch of tests cognitively to see can the kids that we're seeing in school handle these tests or is it too much? So basically, they took those. They spent a week up here, and then they were able to publish, or they are publishing that. And then from that, they learned a lot of like this was too much testing. This was enough testing. The kids wore Fitbits and they were able to say, like, you know, can the kids wear the Fitbits was a great question. Some of our kindergarten or first graders, the like smallest size Fitbit did not fit their wrist. So little things like that that they were able to like come up with that like, okay, that didn't work. And now in January of 2025, we hope to do our pilot study, which will include 40 kids being under chiropractic care for 8 weeks and measuring the pre and post benefits of chiropractic.
Beautiful. I love that. So
Mhm.
Dr. Havoc from all the way from New Zealand or Australia? Which one is she? New Zealand?
She is in New Zealand now,
Okay,
originally from
gotcha.
Australia.
I was gonna
Yep.
say you don't like mixing the two, and I want to say, yeah. So
Yeah. So she's at New Zealand Chiropractic College now. Mhm.
gotcha. All right, cool. So yes, world renowned in our profession for sure for what she's brought to the table and verified in many ways objectively. So this is nice to gather that information.
Yeah,
Um,
one of the things she's really looking at is the effect of the adjustment on the prefrontal cortex. So where your higher thinking is. And if, she's researched it in stroke victims and adults. And now she's like, if we could show in kids what this does to their brain and how the prefrontal cortex lights up after an adjustment, really that ties into their education, and how they can succeed academically, which is one of the things that the school is obviously looking at is like, how does this impact their school day?
right. Well, if their cognitive function is improving and their ability to focus is improving, I know some adults that could benefit by that as well.
Yeah,
Yeah.
all of us.
Right. Well, that emotional scenario you gave us earlier with the little guy, I thought you were watching me in my life for the most part because the funny thing is, I know we talk about this. I talk about with my patients is the inability for me coming from a large family, seven kids. I'm number six. My mom was juggling a ton, And yet we were all provided for. But the fascinating thing is, in helping some other kids in my life, I realized their ability to process emotions differently than I was taught to process them, which means when we have this emotional response, sometimes we don't know where it's coming from. I don't have a name for it. I don't know what it is. It just feels uncomfortable. And therefore, it bounces around in my body. And yet, I have no way to just let it be. Or I know I need to get adjusted, but my adjustments came when I was a kid, and my mom said you need an adjustment, and it was an attitude adjustment, and she was right. And what do you think I said? No, I said no. I'm not. That's exactly why I needed an adjustment, right?
Yep.
And the funny thing with that was we were close enough where we could ride our bikes to the chiropractor. We knew it was like basically 3 blocks away, and one busy street we had to cross, and I'd get adjusted, and sure enough, there'd be less fighting, less irritability, you know, just more toned down and even keel. And that was a big deal because not only did it make my mom's life easier, my siblings, but we all interacted on a different level because of that. But the highlight I wanted to point out with your analogy with that child is that that is the whole population that can't always formulate their emotions. And we find different ways where we act it out. Some act it out with just anger. You can't tell. Some get quiet, internalizing it. We stop breathing, we get anxious, and all these other things develop anxiety, depression. So I love that how you languaged it, Dr. Amanda, and then the impact you're having on these kids at such a level. I think it's worth addressing the financial non-remuneration that you guys are getting as a result of this route. Tell people, like, is this a money-making thing, or do the schools not pay well? I mean, let's talk about that just for a moment so people can get a handle on.
Yeah, so we run everything. The school does not pay for anything. We are simply contracted to come into their buildings and use their space. Potentially down the road, could this be something that the school district employs? Potentially, we just have to show the research. Currently, school districts employ PTs, OTs, speech therapists, in some cases, and then in some cases they contract like us, like mental health services in our district are contracted. So that means that we are responsible for billing our own stuff and we only get paid based on what we bill. So when we go into the schools, we're accepting Medicaid, which in our state, it does reimburse chiropractic and subluxation based care. However, it is very discounted what we get reimbursed.
Hmm.
So, it's not a moneymaker. We are here, on a mission to serve some of these kids. And that's another thing too, is like, not every chiropractic office accepts Medicaid because it doesn't make you money. So some of these kids would never have access to care based on financially what they can and can't afford. So no, it is a mission driven vision that we are trying to carry out here.
Well, and I think that's worth clarifying to the public because there's, misconceptions about what happens. I can try to refer Medicaid patients in the city of Madison, and it is extremely hard to find for those people to find someone who's actually providing Medicaid care, which we don't in our office. And it doesn't mean it's a bad program. It just docs can't afford to do it by the reimbursement level. So what you're doing is amazing. I realize you might even be barely covering your costs with it, is what I would interpret, knowing the system. Maybe that's different. However, I realize, and what people do need to realize is this is a, a mission of passion and purpose for you guys to make an impact on our next generation. I know that because I know you and Dr. Lona, and I know the commitment. So the fact that she just reached out and did it to get it started, you picked up the ball and are just running with it awesomely, which is again so proud of you. Proud as because you're a young doc, but you're no longer young. You're now a new mom. How old is Avi?
Avi is 16 months, so just over a
16
year.
months.
Yep.
And you're having fun, and it's changed perspective. Tell me
It
how
has.
it's changed perspective for you, maybe from a parenting and without getting into the school system side of it.
Yeah, I think even just from like how he came into the world, like I was 42 weeks and wanted a home birth, and they were telling me that you have to get an ultrasound at this point to still deliver at home. And I remember, obviously a home birth is a whole nother gamut. And then I had not had any ultrasounds, and I was pretty like, no, I trust that, he knows what he's doing right now, and he'll come when he's ready. And I remember going to bed at 41 weeks and 6 days, and they had scheduled and said that I had to do an ultrasound on the next day. And I went into labor that night, and he came fast. He came 3 hours. Actually, no one was there except for my husband and I. So we had an unassisted home birth. And my husband delivered him. And I think from that moment, it was like, all right, you say that you trust the body, you say that you trust what's happening. And like that was like when rubber meets the road, what do you really choose? And I really believe that is like, my whole life purpose has been like the body is so intelligent. And when you have a child, you really get to like step into like, do you trust that? Do you trust what's happening? And you get to make decisions differently. And I think that's been fun to just say like, okay, we're probably not doing what traditional medicine has said. However, we're opening the door to a really healthy child that's thriving. And you just really learn grace of, everyone's doing the best they can with the knowledge they have. So it makes you want to speak out more of like your experiences because, here I am, I've had a successful home birth and a healthy baby, and he's thriving. And if I don't share that, then no one else knows, you can choose things differently for your family. So it's been a great adventure raising him and, stepping into motherhood. I wouldn't change it for anything.
That's an awesome story. By the way,
Yeah.
was your birth plan, you said they. Who are they that recommended the ultrasound?
My home birth midwife. Hmm.
Perfect. So
Yeah.
even in the midwife range,
Yep.
they're
So
using that or
in this,
recommended that.
yeah, in the state of Wisconsin, after 42 weeks, it is like strongly recommended that you get a like ultrasound. And I get it. They wanted to make sure baby's heartbeat was still like they had a heartbeat, but make sure baby was still getting enough nutrients from the placenta and things like that. And I trusted. I was like, no, I feel like he's good. I was really, really small. Like I didn't gain a lot of weight. So I was like, and when he was born, he was only 7 pounds, 4 ounces. And I was like, I think he just needed a little more time. Like, I did CrossFit during my work or during my pregnancies, which is a whole nother like, is that okay? Is it not? And, I just think all along I had a great pregnancy. So I just trusted that, you know, I know that he is going to come at home when he's ready. And that's what happened. So,
Beautiful. You
mhm.
said you had a great pregnancy. To our young moms, what's a great pregnancy? What's the first, second, third try like? Tell me
Yeah.
what made it great.
Yeah. Regardless, first trimester is tiring. And you know what? I napped a lot and it was beautiful, like to just really rest. I didn't have any morning sickness. I just made sure my nutrition was really, really high of I was getting all the fiber and definitely I ate a lot of protein. And I felt really like energized from food. And then I moved my body my whole pregnancy. So I continued to go into 9 schools and adjust up until 40 weeks and 2 days. And I probably would have kept going, but I think my lesson in it was, I needed to learn to stop and slow down and like shift my focus. And I needed to focus on being home in order for Avi to decide when he was ready to come. But yeah, I think as far as a great pregnancy, like you can move your body throughout your whole pregnancy. You can, eat foods and trust the process. Like I said, we didn't have any ultrasounds. We actually didn't even do the Doppler or things. So like we really were trusting, God's will and whatever was meant to be was coming. And it was a fun journey of just learning the changes of your body and trusting. That was huge.
So, well put, by the way. I remember in my mom, both my parents have passed, but I remember hearing my mom say how good she felt when she was pregnant. Okay, maybe that's the reason she had 7 kids. I don't know, but that was a generational thing. But the pun there is the peculiar part is how good she said she felt when she was pregnant. And I hear both sides. Some women really feel good pregnant, some just struggle with it and their their bodies for whatever reason. I have my own clinical reasons why that can happen. You do too. What's your take now, both as a successful mom, a clinician, and a student of the game? What do you attribute to your pregnancy success, but also the fact that it was great when you were pregnant?
Yeah. I think mindset and what we feed our minds is the most powerful thing. So whether that's the books that you're reading, the other providers that you're working with, my midwife, she was wonderful. I could ask her any questions, super supportive. She knew how I felt about everything. And, yes, at 42 weeks, she had to make her recommendation, but that was based on her clinical knowledge too.
Mhm.
And I trusted her. So again, just what you are listening to, who you're looking up to, what you're telling your mind, what you're telling your body, there's so much power in your thoughts and what you tell yourself. So if you're saying like, I feel great, I am moving, baby is thriving. I remember, rowing at CrossFit doing like, baby, we do hard things, but we're good. Like, and just talking to, Avi at the time of like telling myself like, yeah, this is hard to row, but we're going to keep doing it because it feels good. And I feel good after. And just the mindset going into pregnancy, and then the mindset throughout. I did hypnobirthing. So any of you future mamas out there, hypnobirthing is a like hypnosis that you can practice and meditation that you can practice as you go into labor. And again, my labor was really fast, so I don't know that I like consciously did any of the hypnobirthing at the time, but I'm sure I was in a meditative state. And when you're giving birth, you go to a different state of being, and just allowing that and not being fearful of it was what set me up for success.
My nodding, by the way, was me imagining that different state that a mom and a woman goes through, not
Yeah.
that I'm familiar with it. So don't
Yeah.
misinterpret.
No, it is transformational, that's for sure.
Yeah. Well, Dr. Amanda, thanks so much for being here today and
Absolutely.
addressing our questions. What you had said, by the way, the research project that's going on 1 and 2, and then tell
Yeah.
us where you're at right now and what is it you need?
Yeah, so we are currently fundraising 150,000 for the pilot study of January 2025. Currently, we are working with some legislators in Wisconsin that, they know where some grant money is. Also, as we're looking at mental health and other avenues that, this could be a solution to some of the things happening in our state. We are, circling back to them of like, where can we fundraise some of this money? We up to this point had fundraised 50,000 for all the initial research, and that was by knocking on friends' doors and telling
Mhm.
them the story. So now, we need some more money, and we're looking politically, but also at some of the educational, so like the chiropractic universities to get support from them as well.
Yeah. So on an individual basis, can people donate to this research study to help this study kick off?
Absolutely. We have a nonprofit. So if you just go to on-site chiropractic, uh, and there's a nonprofit page on there, and you can donate straight from our page.
So ON-SITE chiropractic.com.
Chiropractic.com.
Great.
Yep.
And we'll have all that information. Any other information you want to share where people can either find you or you have
We
a
also have
podcast?
an Instagram. It's school-based Chiro is our Instagram, and we just started it, but we're excited. We're going to use it just to tell the story a little bit more and really, tell some of the testimonials and the history of where we came from, and really just start to tell the world about school-based chiropractic and how it can change the world. So I would love if you guys followed us on our Instagram.
Beautiful. Awesome. Thanks so much. Parting thought.
Yes. Trust your body. It's so intelligent. And, we have to nurture our youth because they're our future.
Beautifully put. Drop the mic on that one.
Thank
Thank you so much for being here today. Great
you
job.
for having me.